Okay, I'm getting ready to let everyone in.
Very good. Good evening, everyone, and welcome. My name is Dr. Dorian Miller. I'm the director of the Center for Community Health and Vitality, a part of the Urban Health Initiative at the University of Chicago Medicine. And on behalf of the Urban Health Initiative and also the Institute for Translational Medicine, I'd like to welcome you to our May Community Grand Rounds, which is the last Community Grand Rounds that we will be having for this season. But I think actually that this is probably what the most important one that we're having for this particular year. The reason why is because we have a number of guests tonight who are going to talk about the work that they've done in helping to improve health, and not just to improve it, but to transform health here on the South Side of Chicago through the Southside Healthy Communities Organization. So I'm absolutely delighted to welcome you here. Before I start with my introduction of my guests for this evening and their brief presentations, I'd just like to acknowledge some partnerships. In addition to the Urban Health Initiative and the Institute of Translational Medicine, who are both sponsors for this series, which has been going on since 2010. So we are now in our 12th season of Community Grand Rounds. I'd also like to thank the involvement of our Pritzker medical students, as well as the Graduate Medical Education Community Champions Program, which has been participating in the Community Grand Rounds series for the past few seasons. And also, and most importantly, our community partners who have been critical to helping us to support this program over the years, including developing the topics for presentation, helping us with audience development, and also being able to provide guests for us for guest presenters. We also have some special guests that are with us this evening that are participating from the Graduate Program on Health Administration and Policy, or the GFAP program. So for those of you who are on our little box screen here, you can see something that's called the Uchicago Grad program, and a number of our graduate students from a variety of schools at the University of Chicago, including the Harris School for Public Policy, our law school, our medical school, as well as the Booth School of Business, who participate in this multidisciplinary program that addresses issues around healthcare administration, and healthcare delivery here at the University of Chicago. Without further ado, I'd like to get started with our program and introduce our first speaker, who is Ms. Brenda Battle. She's the Senior Vice President for Community Health Transformation and also the Chief Diversity, Equity, and Inclusion Officer at the University of Chicago Medicine. And she's going to provide us with a brief overview of the Southside Healthy Communities Organization and healthcare transformation on the South Side of Chicago. Ms. Battle?
Absolutely. Well, thank you very much for inviting us to talk about the Southside Transformation Project, and my colleagues here. We've been working diligently together for almost 2 years in creating what we feel is the right model for the South Side to address some of the stark disparities that our communities have faced for a very long time. We all, as providers of the South Side, care about our community, and we're taking care of individuals in our community day after day, and We see the disparities that our communities face, and we understand the root cause of so many of those disparities. But more than just we as providers coming together and stating what we know to be the case, we took this model to the community actually and got community input on how they saw the disparities play out on the South Side of Chicago. And I'm just going to name a few of them and then get into talking a little bit about the SSHCO and move on. But first of all, the South Side is a healthcare provider shortage area. We have fewer primary care providers. We have about 100 few primary care providers on the South Side. We have about 75 fewer specialty care providers on the South Side, and this is compared to the West Side. We have 60 fewer OB providers on the South Side, and we have about 60% of care being delivered in emergency rooms or in hospitals because of the issues of access. 56% of the people on the South Side leave our community to get care, or some of them just don't get care at all. All these contribute to the disparities that we see every day as we're taking care of patients in our respective institutions. So we 13 providers came together as a force with that kind of input from the community and input that we already knew about to form this coalition, this incredible coalition, something that actually just has not existed in this way anywhere in the country. So we came together and joined forces to work on addressing these disparities by organizing our work together as a collective of providers on the South Side. And we named ourselves the Southside Healthy Community Organization with full intent of bringing health and well-being to our community. So I'll stop there, and I'm just super excited to be on here with my friends and colleagues. So I'm gonna shut up on that question.
Thank you so much, Ms. Battle. And I'm looking forward to hearing you to contribute more as we continue the conversation. I'd like to next move to Dr. Erica Steed, who is the Chief Operating Officer and Executive Vice President for Sinai Chicago Health Systems. And Dr. Steed is going to talk a little bit about her role within the organization, within the Southside Healthy Communities Organization, and to reflect a little bit on how this particular organization will benefit the communities that you serve. Dr. Steed?
Thank you so much. And I'm really feeding off of the energy that was just established by my colleague, Brenda Battle. So I'm just so honored and delighted to be here to really talk about a topic that is very near and dear to my heart. So just as noted, I currently serve in a dual capacity for Sinai Chicago Health System. So I serve as the first minority, first Black appointed chief operating officer in a 102-year history for Sinai Chicago that really serves some of the most marginalized, vulnerable, underserved communities on both the South and the West sides of Chicago. In my current role, I have oversight of all of our hospitals, all of our ambulatory clinics and infrastructure throughout the organization. And I also serve in a dual capacity as the first minority appointed, the first Black appointed president for our flagship campus at Mount Sinai and Sinai Children's Hospital. So with that being said, at Sinai Chicago, we are the largest private safety net health system in Chicago, really serving a high proportion of uninsured, underinsured, and Medicaid patients. So greater than 90% of our base of patients actually make up that overall makeup. And most certainly, what we are presented with on a daily basis is really combating the challenge of just the pervasive inequities and healthcare disparities that have plagued our community for far too long, where individuals utilize the emergency department as primary care because they cannot seek adequate healthcare to keep them out of the four walls of the hospital. So this is something that Sinai Chicago is absolutely deeply rooted in. And what I'm just pleased about is this coalition, the first of its kind, and really a model that should be symbolic and really put on a pedestal across the nation, is a collaboration and a force to be reckoned with of, bringing together distinct organizations for the common good of our communities at large. So for me, that's what it's all about. It's the strength in numbers. It's pulling multiple organizations with a common spirit to really tackle these pervasive disparities and inequities that have lasted for far too long. So we've all done a lot as individual organizations individually. And I think that what this is a statement of is, I think we've come to the end of the road on what we can do by ourselves. I think that the collective strength of this organization is really symbolic of making a powerful difference to really improve the health of the lives of those that we serve, to truly increase access to care, to address unmet needs, to revitalize economic developments in our community, to provide a gateway to just a newer way of life. So I'm extremely excited about the work that we're doing, and I'm very proud of being a part of an inaugural group that is really pulling this together.
Oh, thank you so much, Dr. Steed, for those comments. I think that the spirit of both energy and excitement and collaboration really has come through and is an extension of the comments that Ms. Battle just gave a moment ago. I'm going to turn next to Dr. Barrett Hatches. He is the CEO of Chicago Family Health Center. And Dr. Hatches, can you talk a little bit about your role within, and your organization's role within the Southside Healthy Communities organization, and how you believe that this particular format will benefit the communities that your organization serves?
Thank you so much, Dr. Miller, and thank you everyone for being a part of this conversation this afternoon. And you will see a common thread between all of us, and it is the fire that we have and the excitement that we have for having the opportunity to do so much good for so many people on the south side of Chicago. And the beautiful thing about it is most of the people on the south side of Chicago that we'll be able to touch don't even know it's coming yet. And so we're going to surprise them with wonderful care, and we're going to do this by this tremendous collaboration. So one of the things that people ask is, how is this transformational? Well, when you think about the fact that these 13 organizations have come together and it's never been done anywhere, that's transformational in itself. And it gives us the best opportunity to put us in the best position to provide the best care for people on the south side of Chicago. So let me back up. I got caught up there for a minute with Erica and Brenda. Good luck, Margie. But I operate a federal qualified health center, and we have 6 clinics, and they're all located on the south side of Chicago. And as a federal qualified health center, it's our responsibility, it's our mission to see everyone who shows up, regardless of their ability to pay. So this transformation organization will allow us to have greater access to care, both by the scope of services that we offer and the locations that we offer those services in. We have dental care, behavioral health care, primary care, WIC programs, and we try every day to integrate those services so if you come in here to see a doc for a primary care doc, that we integrate you into our dental health services. We integrate you into our behavioral health care, make you aware those services are available to you. And so another thing that the Transformation Project is going to help with is that it's going to increase the number of providers, primary care providers that we have. That's access. The more docs we have, the more greater access to care we have. We're going to increase the number of behavioral health providers that we have, because I can tell you, it's been amazing, sadly so, the demand for behavioral health as a result of this pandemic. And I don't know about you, Dr. Miller, but I can't find anybody anywhere that I know who at some point doesn't need somebody to talk to about what they're dealing with. They may choose not to do it, but it's not that we don't need that happen. So I've seen us break down just a little bit the stigma about seeing behavioral health specialists, because we all recognize that this pandemic has done something to everybody. We've all been touched in a way. And so if there's an opportunity to have some conversations with someone to help us deal with these issues, that's a huge plus. So we're going to have additional behavioral health access. We're also going to have about 250 community health workers, something that most of us don't have. These are folk who will put their arms around, literally in some cases, put their arms around the patients on the South Side, help them navigate through this system. I mean, we have a tough time navigating through the system, and we're in it. So to have people help you navigate through the system and make sure you get the best care. So let me back up one more time and talk about my role and my representation of Chicago Family Health in the Southside Health Community Organization. I'm on the board of directors. I serve as the vice chair of the board, and I'm also on the executive committee. So every organization that's represented in this transformation project has an opportunity, has an equal voice in what we're doing. It's not dominated by anybody. You know, it's really interesting when you think about it. When you look at the 6 federally qualified health centers, you look at the academic health systems, and you look at our safety net hospitals. In some way, you could stand back and say, "Well, wait a minute, aren't you all in some way competitors for the market out there?" We have formed a co-opetition where we work together. We still have our primary responsibilities in our communities, but we're working together. And I'm sure, I'm going to take credit for being a part of this organization for the rest of my life, because we're going to do so much good for so many people. I'm going to be proud of it every day. And again, it's an honor to be a part of this organization. It's even more of an honor to know and firmly understand and believe that we're going to change some lives. We're going to make better healthcare for individuals and better healthcare in communities. So I'm so excited to be here tonight, and I can't wait to have another shot to say some more.
Oh, Dr. Hatches, thank you so much. I think that you set up our last introduction and speaker very well, because you put in a phrase there that people may not be as familiar with as you might think, and that is the presence of community health workers. But I think that not only the energy and the spirit of collaboration is there, but also the issue of innovation, which is something that I think is coming through very loud and clear. Let me introduce Ms. Margie Johnson. Ms. Johnson is the CEO and Executive Director of Beloved Community Family Wellness Center. And Ms. Johnson, if you could talk a little bit about your role within the Southside Healthy Communities Organization, your perspectives on how this particular collaboration is going to benefit the communities, and not just the communities, but the people that you serve. But this is also addressing another need around community health services, not just community health workers, but a potential opportunity for members of our community around employment. So if you could talk a little bit about that, please.
Well, thank you for inviting me to be a part of this. And I echo everything that has been said. And I am excited that we have been successful in receiving funding to help transform the healthcare on the South Side of Chicago, which is greatly needed. I am the CEO of the Beloved Community Family Wellness Center, and I'm also a co-founder of Beloved, which is located on the South Side of Chicago in the greater Inglewood area. And my role is to provide the overall direction of our health center under the guidance of our board of directors. I am responsible for ensuring every aspect of our health center operational policies and procedures, services and facilities perform effectively and efficiently, while guaranteeing that all employees have the equipment and resources needed to deliver the best quality patient care. Our mission is to provide holistic, comprehensive, accessible, and quality primary healthcare and social service programs to individuals and the community, with a particular focus on the healthcare needs of the medically underserved population. In terms of our services, we provide primary healthcare, behavioral health, substance use disorder, mental health, oral health, community outreach, care coordination, nutritional counseling, transportation assistance, and much, much more for all life cycles. And our motto is caring people, caring for you. And I think this is what this transformation is all about. us caring for people, improving healthcare services. What this collaboration would mean to the Southside residents, it would benefit the greater Inglewood and surrounding communities we serve by strengthening our abilities to decrease healthcare disparities affecting the Southside community, to better connect existing healthcare organizations, to increase access to care, to ensure adequate primary physicians, providers, and specialty care providers are available to serve our patients and community, and that they are available in a timely manner and without long waits and without traveling outside of our community for services. So we are excited that this is happening. This collaboration will also allow us to address unmet chronic care disease and behavioral health needs, including social determinants of health. We will be able to improve care coordination activities, provider collaboration, community engagements, and much, much more. To also provide connected digital technology infrastructure, which is greatly needed in the services on the south side of Chicago, and ultimately to build health equity and to ensure stronger and healthier community. We are looking forward to continue to be part of this in 5 years, to be able to tell a story and to show how we have improved health outcomes on the south side of Chicago. Our community is very engaged and looking forward to the changes that are coming. And I think we've gotten off to a great start. So beloved Community Family Wellness Center, along with all of the other entities that are part of this collaboration, is ready and willing to work hard in terms of making the changes and looking forward to showing how we have improved and showing better outcomes for the south side of Chicago.
Well, thank you for your comments. I think another theme that you just introduced into the conversation here has to do with infrastructure and connectivity, and that even though these are different organizations that in other ways have sometimes been seen as competitors, that there's actually going to be a way in which we can knit all of that information together through an infrastructure online. So I think that's a very important introduction to how this is going to work. People are going to be working together, and we can ask a few more questions about that in just a moment. We're starting to get some questions into the chat, including, I think our audience is picking up around your enthusiasm about this and also the willingness to spread the word about it, which is part of the reason why we're having this conversation this evening. But I've gotten one question in that I would like to address to Dr. Hatches. Can you talk a little bit about the funding that the Southside Healthy Communities Organization has received from the state of Illinois?
Yes, you know, it's one thing to have a plan. It's another thing to bring a group of people together, but you got to have a way to support it. You got to have a way to support it and sustain it. So we were fortunate and very excited last July to find out that the Southside Healthy Community Organization had been awarded funds for the plans that we developed. And these funds were really a result of the hospital and healthcare transformation bill that was passed by the Illinois legislature back in March and was signed by Governor Pritzker. And this bill dedicated $150 million over the next 5 years to address health equity by sustainably improving access and outcomes. And so the Southside Healthy Community Organization, again, was benefited from this bill. And again, that's the sort of the juice that's needed to move the engine to get us all sinking in the same direction, because we had a good set of plans. And so not only did the funding help, but just us coming together every day. I mean, we meet so much that it's just amazing. We meet every week, and then the executive meeting meets every other week. So we are tied to this, and we're committed to this. And then, you know, I'd like to say also, Dr. Miller, that not only are we committed to it, we want to be held accountable for what it is we said we were going to do. We are serious about this, and that's why we've had town hall meetings. We've had other meetings to let people know this is what we're doing, this is what we intend to do, hold us accountable for it. So we're excited about the fact that we received this funding from the state.
Oh, thank you so much for that, Dr. Hatches. Anybody else, any of our other panelists like to add into that before I move to the next question?
Well, I would just add that there are other transformation projects across Illinois. We were the highly funded one based upon our need. I mean, we have a very large community with a lot of density and less access to care. So appropriately, I think we were awarded $146 million over 5 years to do this work. And to Barrett's point, you can't do it without the funding.
Thank you. Another question from our audience, because I think that with the presentations that have been given thus far, that there is enthusiasm, but also the question of communications and marketing. How is this information going to be communicated to people in our communities regarding the efforts that have taken place? You mentioned town halls a little while ago, perhaps amongst the healthcare providers, but if I live in the Roseland community, if Auburn Gresham, if I live in Bronzeville, how is a person who lives in those communities going to learn a little bit more about what's available to me with this particular program? And open question for any of our participants, whoever would like to take that on.
Anyone, colleagues?
Go ahead,
Colleagues?
Well, I'll start and others can add to it. So one of the things we did early on, you're right, we started with several town halls, and we have plans to continue that work to disseminate the information. We've been working with a marketing and communications firm that's helping us to build an extensive communications plan strategy around how we get the information out. It has to be widespread and broad. And so over the next few months, we expect to see, as we announce that our organization has hired a CEO to oversee, help us to facilitate this work, more and more, not only engagement, but more publicity around what we're actually doing. Some of this has got to be boots to the ground and leveraging our community health workers to be at a very grassroots level to do outreach and be in the community and talking to individuals. So we've got to do it from multiple prongs, not just from a marketing PR campaign, but talking to individuals at the ground level, at community events and at churches and other forms in which we can get this message out, as well as through our respective healthcare organizations. So a multi-pronged approach that we hope to execute over the next several months as we plan to launch the Southside Health and Community work.
Yeah, I would add into that, Brenda, and just number one, agreeing with the fact that this really needs to be a fluid process, and this is not a one size fits all in terms of the way we market and the way we communicate. In some respects, this is going to be an experiential aspect of communication as well, by really engaging directly with our collaborative organization and really having that FUBU principle, for us, by engaging the community directly in making tweaks in our model as we go along to ensure that we are adequately anticipating the needs of our community and really addressing the needs of our community simultaneously. So a lot of this is truly going to be boots on the ground. We're going to have to create those vessels where we can go directly to our community and neighborhood patrons as opposed to having a process where they come to us. So we are completely open and adaptable to making changes and adjustments along the way to ensure that is being addressed.
I would just add that we are all trusted healthcare partners in the communities that we serve. And as an example, Chicago Family has clinics in Roseland, have clinics in Pullman, South Chicago, Southeast Chicago, 63rd and Kansas. It's our responsibility to communicate out to the communities that we serve every day about this transformation project and the greater access. And so it's not just going to be a standard marketing play here, as Dr. Steve was saying. We're going to have to be out there hitting the pavements every day. We got to hit the churches. We got to hit the community organizations, some of the same organizations that we engage with at the beginning of this process, to find out what their thoughts were around it. And we've always been surprised by the number of people who showed up and responded to our surveys. And so the community is engaged already. And I don't believe they're going to allow us to not do what we said we were going to do. And the way we're going to stand in front of them, we're going to talk about what it is we're going to do. We're going to solicit their input. We're going to make sure that not at the end of the 5-year cycle, but every day we're measuring the increase in access to care that we're doing. And so we're going to be all over the place. We have no choice.
Dr. Hatches, thank you for that. I'm sorry, go ahead, Ms. Johnson.
Another way in terms of marketing and getting the word out is through the use of the community health workers and the care coordination team that we're going to have. This is going to be something that we're going to be doing more of. We're going to have about 50 community health workers. And by them working with the patients and the community residents, and they seeing a difference, and they seeing help and support, they seeing how to ways to navigate the system, it's going to allow them by word of mouth to go out and tell other individuals what's going on, the difference that they see in their health services and their ability to work through the system. And more individuals are going to want to come and to be part of that. So I think that's another way that we're going to be marketing our services.
And Dr. Miller, if I can build on what Margie said, these 250 community health workers, our goal is to hire them from the community. So you're talking about people from the community working to help people in our community. So that's how fast the word can spread at a very grassroots level, by leveraging the people in the community as the workers for this model in care for the community.
You know, I really appreciate the issue that you're underscoring right now around how this is going to be a multi-pronged strategy in terms of being able to communicate this with community members and to do it in a way that builds upon those experiences. And so it's not something that's going to be locked in or set in stone with some sort of community engagement strategy, but something that really comes from facing the needs of community, and in particular, working with those community health workers. I've gotten a suggestion on here by one of our community partners. Utilizing community media is also a great way to share information. And so this is something that I think is a very important point as well. We oftentimes, when we talk about these types of things, we think about hospitals and systems and clinics and how things come together from the systems perspective. But Dr. Steed, I'm going to turn to you for just a moment, because I think at the end of the day, when people think about their healthcare, they think about it from an individual need, from a personal perspective, and what works for them. Can you talk a little bit about how a system like this could possibly help to transform the care and the coordination of care for an individual?
Sure. So in essence, I think that what you're hearing in all of our voices is the fact that we are so passionate about this as individual organizations, and we've been at this for a while individually. So I think that this really came together upon really acknowledging the pervasive health disparities that exist across the board. So we are really pulling together, forging together as a strong coalition of community voices, including our elected leaders, our faith leaders, our community-based organizations, our foundations, and other healthcare providers, to really start a process to really develop real, authentic transformation at its best, and really put words into action, really. So it really evolves from the collective of these stakeholders in really having a real inclusive process, and ensure that this plan is really driven by the community. And I really want to just really showcase this through a really key example of what we're really trying to drive towards on the South Side. So I want to just showcase an example of Gerald. So Gerald, like any other neighborhood patron, he has high blood pressure for the last 10 years of his life. And he was diagnosed with type 2 diabetes 3 years ago. He has a family history of diabetes, gets his care advice from his uncles as opposed to seeking out healthcare traditionally, because there's a lack of trust. So he doesn't necessarily trust the doctors. He doesn't properly feel as if his voice is represented or he's heard ultimately, and he's not feeling understood on what he's going through as an individual. So he takes his medication twice daily. It's very difficult for him to keep track of his daily sugars. So he doesn't manage this effectively through a culmination of all of those components that I just spoke of. And actually, he doesn't have the adequate resources to effectively manage his care. So oftentimes he runs out of strips to even adequately check and monitor his blood sugars. So over the course of a year, Gerald has gone to the emergency department 4 or 5 times over the course of a year. So he ultimately seeks out emergency department care as his primary care because it has risen to the point where there's a lack of trust. So that is ultimately eroded, and ultimately he does not see his physician again to his next ER visit. So he's jumping around from ER visit to ER visit to ER visit. This is exactly a situation that we're looking to reverse. So the example of Gerald is actually translated multifold across the community at large. And this is where you have an overpopulation, overutilization of emergency departments, unnecessary hospitalization, and then just a pervasive chronic unmet need in our community at large. So that is the classic example of what we're striving for. And on top of the example that I provided, Gerald is very likely to have difficulties even accessing that emergency department because he lacks proper transportation. And then when you transition to the next level of care or back home to his home environment is probably not situated in a substantial way where he has access to healthy food. He probably has inadequate housing to meet his other social or economic needs. So that is in a nutshell an example of what we're combating together to really address and resolve.
Dr. Steed, thank you so much for that example, because I think that oftentimes when we talk about making major changes with different healthcare systems and integrating things, people often have the question, how is this change in the way that business takes place going to help me in the long term in terms of being able to support my health? And so from those examples that you've given around Gerald and its care, and in particular, we've had a question to come up into the chat that has to do with community trust and how people are encountering these systems, that I think that being able to explain and to garner that trust from our community members around saying that this is something that we're working on in partnership with you in order to make sure that it satisfies your needs and preferences, I think is just so incredibly important. I'm going to switch over a question right now to Margie Johnson, because I'd like to talk a little bit more about community health workers. One of the things that we know about social determinants of health is that people who tend to be healthier are also people who tend to address some of these needs around transportation, healthy food, safe housing, and community health workers can certainly help that. But also it sounds as if there are going to be some employment opportunities that are generated as a result of the Southside Healthy Communities Organization. Can you talk a little bit about the community health workers, please?
Yes, our goal is to hire 50 community health workers in our first year. And these individuals would be working with our patients and our providers to help our patients to better navigate the healthcare system. They will be trained to work throughout the Southside of Chicago, and they are going to be able to educate residents about healthcare resources that are available to them. This is just the 1 year target with the 50 that we're looking at bringing on right now. These positions will provide critical connections that enhance care delivery and better outcomes. The direct level of support and hands-on help can break through what sometimes feel like red tape and confusion and provide levels of calm, control, and coordination, especially for parents with complex clinical and social needs. So we're going through the process now. And in fact, I think the job has been posted. I don't know if it's still up in terms of people being able to apply for an opportunity to be a community health worker. We got a flood of resumes for individuals and looking to bring them on and to train them. This is going to make a big difference. I know that within our healthcare system, there are many times when a patient come in and they're speaking with their provider, but they need help in terms of navigating the system. And sometimes it takes a lot for us to connect with other entities to get the information that the doctor needs in order to provide care. So if you were sent, let's say, to the cardiologist, but we don't have that report. And so we're holding up a waiting room, not a waiting room, an exam room in order to provide service to you. Having these community health workers are going to help us and help the patient to navigate that system for us to get the information back and have it back at the time that you have your appointment. So this is going to allow the flow of services to move a lot better than what it is now. We are excited, the doctors are excited about hearing that we're going to have community health workers on site providing this type of services. And you can't do it with one community health worker. So having the appropriate number available to us through this transformation is going to help us to improve health outcomes. So we are excited about doing that.
Great, thank you so much. Ms. Brenda Battle, do you have anything else to add about the issue of the information technology that's going to support all of this? Because I think the points that Ms. Johnson were making about care coordination are just very, very important.
Yeah, absolutely. So right now we've got 13 providers and we have about 7 different electronic medical records. So one way to be able to be effective in care coordination is that we have to link our electronic medical records. And so part of our model is, and a significant part of our model to be able to be effective in what we're trying to do is that our electronic medical records have to be able to share information across our 13 providers at all the sites that comprise these 13 providers. And so that's going to help our care coordinators, who are the real hub to our care. Right now, when we think about healthcare, typically the hospitals or the community health centers are the hub of care. We're creating the hub around these care coordinators, which are largely community health workers, but also nurse care managers that are going to work very closely and side by side with the community health workers and the providers across our respective network. These individuals, as well as our respective healthcare institutions, will be linked by this technology, which will allow us to cut out some of the overutilizations, the lack of information transfer across our respective organizations. Just by linking our technologies together, that will allow us to be much more effective and efficient in care. But the care coordinators, the community health workers, have to be equipped with technology that's going to allow them to immediately at the point of care, point of service, access the social determinant of health resources that patients need to more effectively manage care. So we're also going to be linked together through a technology that will allow us to immediately provide access to those social determinant of health resources that are needed. But also having that, even with that, you need that navigator, you need that human individual that helps individuals to realize how to get access to those services. So it is a combination of the technology, the access to the social determinants of health, the utilization of the care coordinators and care managers as a hub and connector of care that's really going to enable people like Gerald to feel healthcare very differently than they feel it right now. Right now, none of our healthcare systems are connected right now, as it is today. This Southside Healthy Communities organization will transform healthcare in that we will be using the same connected technology system and the same resource to help us to access social determinants of health, to put in the hands of the individuals that we're serving and a group of employees, these community health workers and care coordinators that will link this care across the South Side. So that's different care than how care is being provided today.
Ms. Battle, thank you so much. I think that the issue of care coordination and social determinants of health and integration is providing our audience today with a very big picture view of the work that's taking place. We've talked about physical health, we've talked about social determinants, we've even talked about some potential opportunities for employment. But I'm going to turn to Dr. Steed for just a moment, because I think that the issue of mental health comes up to some extent for our people who live in our communities. It's something that has been identified as being very lacking in so many of our communities, both in terms of the provision of behavioral health services. And although there may be organizations such as yours and others that are providing bits and pieces, how will mental health services be incorporated into the model for the Southside Healthy Communities organization?
Thank you for that. Very much mental health, and we're finding, especially on the heels of this global COVID pandemic, that we're suffering from a pandemic of its own, and that's mental health challenges. So we more and more individuals are actually showing up on the front doorsteps of either jails or emergency departments, really oversaturating them because there's unmet, unaddressed mental health needs across the board. So we have, as a Southside Healthy Community organization, we have certainly agreed to prioritize behavioral health first, because there's such a high need and a severe lack of resources for these important services. It is absolutely devastating to actually see more and more individuals actually show up in jails, and the jail system is becoming the #1 provider of mental health care. So we, as a healthy community organization, we've taken the matters into our own hands and really put this front and center for us. So part of our goal is to work collectively to get more mental health practitioners in our model as quickly as possible before the end of the year. So specifically, we're actually developing plans to begin the recruitment and placement and proper deployment through either in person or those technology enablers that Brenda was really speaking to, so we can actually expand access to these 15 plus new behavioral health professionals. So this is including physicians, so psychiatrists. This also includes psychologists. This includes psychiatric trained nurses. This also includes licensed clinical social workers to serve the South Side. And one particular differentiator that I'm particularly proud of in this model is we're also emphasizing building and growing and developing from our community. So certainly minority representation as it relates to these critical roles is also front and center as part of our focus. But on the mental health side, we're not just looking at traditional mental health. We're also looking at the equivalent challenge, which is substance abuse and addiction that's also plaguing. So our patients and community may show up with a combination of issues that really is demonstrated in the form of comorbidities. So they may have medical challenges, mental challenges, and substance abuse challenges simultaneous with the socioeconomic, social determinant needs that we're trying to address collectively. And that's truly the beauty of the model that we're trying to create.
Thank you, Dr. Steve. We've had a question to come up in the chat around particularly mental health needs in youth and whether or not there are going to be any services that are directly impacting youth and their mental health needs. It's been something that's been identified as being another big lack in terms of services for people on the south side of Chicago. So I'm going to open up that question to anyone.
Yeah, I'll take the first shot at it. Absolutely. All of the care that we are going to have available to the community is available to everyone in the community. So we'll have a focus on young kids. We'll have focus on teenagers. We'll have a focus on young adults. But we have certainly seen through this pandemic that behavioral health issues has sort of been identified as a second pandemic, and it's not going away. And so we know we got to have greater access to care, not just for primary care, but also for behavioral health care. And right now, most of us are offering that care, but we don't have enough providers to provide the care that we need. And so as Dr. Steve was outlining our plans for bringing on board providers in behavioral health, I want to make sure that we all talk about the fact that that's not going to be an easy task because we're struggling every day with behavioral health providers and professionals. But we know that's part of the challenge. We're building a plan around how do we get more providers to come and work in our communities? How do we provide open access to care? And so we recognize that we have to provide care across the spectrum, regardless of what the age group is. And so we're going to be equipped to do that.
Thank you so much, Dr. Hatches. Ms. Margie Johnson, anything that you'd like to add to that?
Well, I agree with everything that's been said. Through this pandemic, what we have noticed is a lot of children due to the working at going to what do you call it, the e-learning, where they were doing school from home, had a negative impact on our manpower. And a lot of it had to do with our social, licensed clinical social workers, our psychiatrists, and so forth. And we lost individuals because they had issues that they had to deal with at home and they could not work. So losing manpower is was a big problem for us. But through this collaboration, we will be able to bring on more licensed clinical social workers, the psychiatrists, and other certified alcohol and drug abuse counselors to deal with the issues. We have some, but we're not at the level of what we need. And so we're excited that funding has been made available to us, and we're looking for people to fill those positions, because on a daily basis, I hear about what's happening with children, what's happening with the adult patients. And we have a lot of success stories. In addition to that, since 2012, there have been so many mental health and behavioral health institutions that have closed due to the economy.
Thank you. So we don't have any other information that's in the chat for right now, but we would really encourage you that if you have questions about any of these areas, to put your questions in the chat. I'd like to ask more of a general question. We just got one here. We have someone who is interested in partnering with the Southside Healthy Communities organization to provide resources. And this is someone who has an organization that provides support for mental health needs to adults as well as youth, as well as diabetes prevention programs. And so this person just anticipated the question that I was about to ask everybody, our participants today, which is, if I represent an organization that could be a part of this, how can I get involved? Because again, spirit of collaboration, spirit of innovation, and being able to give to the community in order to help to build this. So what can I do? Brenda Battle?
Yeah, that actually triggered another aspect of our model, one of which is that our model is built around leveraging the assets that are already in the community. And these are community-based organizations. We as healthcare providers rely on community-based organizations that are already operating and providing services to the community. So built into our model is an opportunity for us to work alongside community-based organizations and integrate them in our care delivery model so that we can partner with them in supporting this work out in the community to scale. Recognizing though, that community-based organizations, if they're gonna scale with this model, that it requires support through the SSHCO. So we recently had led an RFP in the community to learn how community-based organizations can work closely with us. We will be organizing around that work very soon. Right now, if you wanna work with us, please send your information to us at www.southsidehealthycommunity.com. We're collecting this information from community-based organizations through that mechanism. Please submit that to us and we will collect that. And as we move toward expanding our work to begin integrating community-based organizations, we're going to be looking for those of you who can provide this type of support to this work.
Thank you so much, Ms. Brenda Battle. We've gotten a comment from the Far South Chicago Coalition that they're really looking forward to partnering around this process. But we've also gotten in a couple of questions regarding community health workers, one of which has to do with having people who are bilingual and speak both Spanish as well as English. And then also, where will these new jobs be posted for both mental health workers and community health workers? So let's start with this hiring of potentially Spanish speaking community health workers. Is that a possibility?
We're going to ask Erica to answer that since Sui is going to help us do that.
Yes.
Thank you, Dr. Steve.
So I already unmuted, Brenda. So so absolutely. So part and parcel of our goal is to continue to hold ourselves accountable for truly mirroring and parroting the population that we serve. So it's very important for us to properly represent the community from a diversity and inclusion and equitable standpoint. So, and that includes ensuring that we're hiring multilingual individuals that really speaks the voice of the community at large. The Sinai Urban Health Institute is the organization that is going to be helping to anchor and represent the effective recruitment, onboarding, as well as the hiring and adaptation of the community health workers across the board. It's our collective goal to go directly from the Southside communities and hire from within. So that's our goal as well. So we will be posting job opportunities on our website as they come available at that www.southsidehealthycommunity.com, as well as there's going to be other vehicles that we're going to get out there for our mechanisms of recruitment, including partnering directly with the community colleges in the community as well, as a additional anchor of getting these resources really hired up and identified. truly, I see this, and I'm sure that this is shared among my peers as an opportunity to really build up a healthy, economically developmental workforce, and really create new jobs. So over 400 jobs are going to be created in totality once all of this transcends over the next 5 years. So we are extremely excited about that, but short answer, absolutely. But multilingual, bilingual individuals will be hired into these roles.
Thank you. And I also think that there's been a question about how do we find out about the jobs? And that's the website that was mentioned before, the SouthsideHealthyCommunity.com, which is also being dropped into the chat box. And so thank you so much for that information, because as I said, it's not just about, very good question just dropped into the chat. What happens to jobs like community health workers once the funding from the state ends? Is this something that's going to be linked into state funding, or are these going to be positions that are going to be sustained long-term? Brenda Battle?
Well, our goal is not to have a 5-year Healthy Communities model and then let it go away. So we are already beginning efforts to sustain this model beyond the state funding. So that's our goal, to sustain it. It's not going to beyond this 5 years. It took longer than 5 years to create the problems that we have in our community, and it's going to take longer than 5 years to correct them. So our goal is to sustain the Southside Healthy Communities organization indefinitely for as long as we need it. And we are working as a coalition of providers now to address those issues. We began talking to the managed care organizations through philanthropy and other resources that could help us to do that. But that's as important to us as ensuring that we improve health disparities and reduce health inequities in our community. It's sustaining this model for as long as we need it.
Thank you. Another question that's been dropped into the chat has to do with some of the needs that have been mentioned around access to healthy food or safe housing. Areas that are not necessarily areas that hospitals have traditionally dealt with. What does that mean for community organizations, and whether or not those types of supportive organizations are going to be welcomed at the table to connect with the Southside Healthy Communities organization?
Yeah, let me take a shot at that. Absolutely. This is for the community, by the community, and we're going to be seeking help every way that we can to provide healthy food, transportation, housing. That's part again of the role of community health worker, to get out there, to put their arms around the community and the patients, to understand what the needs are. And it doesn't stop there. Understanding the needs is the beginning. And then we have to work together to find out how do we mitigate those issues. And so it's going to be important for us to partner with community organizations, whether it be through housing, whether it's food desert, whether it's healthy food. We've got to work with the existing community assets that we have. It's going to be incumbent upon us to find out where they are, who they are, and how we partner. So absolutely, it's one thing to identify the social determinants. It's something else to address them. We want to identify and then address through our community resources that we already have in place, and build and create them where they're not in place.
Thank you, Dr. Hatches. Brenda Battle, please.
Yeah, I just want to add to that. So the community health centers have, for long standing, have worked on addressing the social determinants of health. They're far more skilled at doing that than the hospitals are. So for record, let's state that. They've been working on closing the gap in food, and food, low excess in food, in transportation, those things for a very long time. Hospitals are newer to that, but what we all know as a coalition of providers is that the community-based organizations are the ones that have really done that, and we've leveraged that. So we want to leverage the expertise of the community health centers, federally qualified health centers that are part of our coalition, and leverage the expertise of the CBOs to actually address these types of issues. And we're going to use, our goal is to use all of the assets, or the assets that provide that level of support. So if it's community gardening, if it's food depositories, if it's any of these things, those are the institutions that have been out there at the forefront of addressing those sort of things. And so this model will enable us to provide what most affects a person's health and well-being. And that's not always the biomedical aspect of care. It's all of these other aspects, these social, environmental determinants of health. And this is what this model is built around. The community told us at the very beginning that we want health and wellness. And wellness was clearly defined to us what that means. And so our model's been built around one that will help to address wellness in our community by supporting the needs of our community that are not just biomedical.
And sometimes that means working with existing community organizations who are already supporting the needs of the community. And sometimes that means giving them some extra support to do it. And this model allows for that.
So I just wanted to tag on just really brief as well, just to make mention of that as part of the work that is heavily underway. We've already pulled together a request for information so we can really cast a wide net to really seek out the various community-based organizations that are out there that has a specific expertise in addressing these social determinants of health. That is one of the true power plays behind this particular model. So that is going to be a fluid process as we move forward. Is we're always seeking for key partners in this, and they can really come to the table and really help to address the various challenges that we're actually talking about. So we've already started to have question and answer sessions with the various community-based organization partners, and that process will continue as we move forward. So that's going to be critically key.
Thank you. I have one other question that I'm going to take from the chat, and then after that, I'm going to ask our panelists to give just 2 or 3 sentences about, for the people who are listening to us this evening, what can they do and in order to both stay engaged and also to spread the word. The last question that I have has to do with older adults, and that is, are there any plans or structures for reaching people who are older, who may be isolated and lonely? So maybe a little bit of a focus on more of our senior population. Open that question to anyone, but perhaps Margie Johnson, if you have any thoughts on that, if I could turn to you, please.
Yes, I think through the collaboration and also with what a lot of things that we currently are doing, being out in the community, having forums like this, doing the town hall meetings are ways to engage and find out what's going on. Hearing what our patients are seeing when they come in for services. They not only talk about their health, but they talk about what's going on in their families, what's going on in their communities. Listening to what they are saying and making sure that we put plans in place to address those issues and make sure that they're done in a timely manner. Through the outreach activities that we are doing, we have been able to identify various types of needs that are out there in the community and work with our team to address those needs as much as possible. And I think through this collaboration, we're going to be able to do more of that. Individuals, when they come to their doctors, they like to talk, and they like to talk about what's going on in their lives. Based on that, the provider provide that information to us. And we look for ways to improve those. And I think through the collaboration, we're going to continue to do this. This is going to allow us to expand what we're already doing and allow us to be better and have better outcomes. So I do think the older population, we hear information about them and we try to address those needs. We're going to be in a better position to do it.
Thank you so much. Would like to start with the question of staying engaged. How can I help? Because I think that there are a number of people who are on the call today who may not only represent community-based organizations, that may not have necessarily been engaged in this before, but would like to get involved. And so, Ms. Brenda Battle, I'll start with you. What can our community organizations that are on the call do both to spread the word and also to get involved?
So please connect to us through our website, because all of this information that we're talking to you about today is actually on the website. Also, ways to inform us that you want to work with us, the access through the website. And we are constantly monitoring that as we engage with community-based organizations around how to work with us, how to build our models that integrates community-based organizations into the model, as opposed to having them as just a referral organization. We need your input in being able to do that. You heard a lot from us today. You know what the gaps are in the system. You knew that before you came to this call, but you know what we know are gaps in our system. If you have solutions for those, bring those to us, because this is an all hands on deck effort to improve health on the south side of Chicago. It's not just these 13 organizations. It's not a few CBOs. This is all hands on deck, and we will change the trajectory of healthcare in the south side, the entire south side, and we need you to do it.
Thank you. Dr. Steed, any final words for our audience for this evening?
All I can say is, you know, you can probably tell by our voices, we're extremely passionate about this, and there truly is power in numbers and power in engagement, and really truly advocating on behalf of our neighborhoods and our community at large, and really giving our community a voice and a seat at the table on these critical issues. I just encouraged all of those who participated in this session to serve as an advocate for us, stay engaged through our website, through our social media platforms, offer up suggestions on what other forums that this group can really start to take the show on the road. We truly want to be pervasive and entrench ourselves in the community for a positive way. So all I can say is I'm absolutely delighted that this group has come together, and we're here to stay. So just get used to us and buckle your seatbelts.
Thank you so much for those comments, Dr. Steed. Turn to Ms. Margie Johnson now. Any final comments for our audience for this evening?
Well, I think using the contact information to let us know about what's going on in your community, what's going on within your business, what type of issues and concerns you have. Tell us how you can help address or participate in the services that we are providing. If there's something going on that we could come to and be a part of, such as community events. I know the pandemic has slowed down a lot of activities that we normally would be doing, but things hopefully are trying to get better, and we could get out and participate in more events and things of that sort. But if you hear of things or know of things that you feel that will be a benefit for us to come out and participate in, let us know. And if it's not something that we could come to, but you know something has some information that you think will be beneficial to the community and patients at large, please let us know about that information so we can see how we can help.
Thank you. Dr. Hatches.
Thank you, Dr. Miller. I would say to you, echo what has been said about accessing the website and making sure that we hear your thoughts. We have developed a model that I'm confident is a good model and that will work, but it needs everyone to be a part of it and to participate. It has to have the community support and involvement. So as you've heard tonight, there are going to be a lot of job opportunities. So one thing you can do is go back home and let people know there's hope. There's chance for opportunities to be not just a part, not just to be employed, but be a part of a transformation of something that will be talked about, not just in Chicago, but around this country for a very long time. Be a part of that. We haven't gotten off so far that we don't need your help. We need everybody to be a part of this. And we want you to get a sense of pride in helping to turn healthcare around in the communities that you live in and where you work and play. So please be involved. Please write us, call us, be a part of this transformation. We've gotten it started and we have a good model, but we need you to be a part of it.
Thank you, Dr. Hatches. Just a couple of closing comments from me. And I think that the conversation this evening that has been so rich and robust really speaks to the World Health Organization's definition of health, which was put into their charter in 1946. And that is, health is the complete presence of physical, mental, and social well-being, not merely the absence of disease or infirmity. And I think that all of the things that we've been talking about this evening, both in terms of the systems of health, how it addresses the individual, what it takes in terms of collaboration, how to address some of these other issues that impact our health, like healthy food, transportation, and importantly, employment, which is actually a very strong indicator of an individual's health, have come into play. And so the comment that was put into the chat a moment ago around how to stay engaged. Thank you so much for that, Dr. Roberson. Keep community members involved at the inception and the forefront of every single decision and step that's made, and to continue to work with community as true community partners and not just to conduct work on them. And so it's about being with someone rather than having something done to or on them. So thank you so much for that final comment. I think that captures things nicely. Before I turn it over to Natalie Watson to close us out for the evening, I just want to remind you that this is our last community grand rounds for the season. We will be coming back during the fall for another year of community grand rounds. And for those of you who have been following us over the years, thank you so much. Again, thanks to the Urban Health Initiative of the University of Chicago Medicine, as well as the Institute for Translational Medicine at the University of Chicago for their support of this program and participation, as well as our incredible community partners that have worked with us over the years to bring you this type of programming to the community. Natalie, floor is open for you.
Yes, everyone. What I am going to do is launch a poll. There are 3 questions just to get some feedback from you all on how we did today. So I am launching the poll and you should see it now, and we'll give you about a minute to answer the questions. Okay, I'm getting ready to close the poll. And so I'm sharing the results. You all should be able to see it. So the first question, I was aware of the Southside Healthy Community Organization prior to this event. It looks like about 38% was aware. Most were not aware or had some type of familiarity of it. And I found the information presented during the panel discussion of value. 90% said this information was highly valuable. I will say for myself, this is an exciting initiative that we have here on the South Side of Chicago, and it's great to know that our audience members think so as well. How likely would you attend a program like this in the future? Likely to very unlikely. So as Dr. Miller mentioned, this is our last community grand round. For our current season, we will start back up in the fall. I do have all of you all's email addresses, so you will hear from me in the fall for our 2022-2023 season. Thank you for joining us and have a wonderful evening.
Thank you.
Thank you.
Thanks, Dr. Miller. Great job.
Yeah, appreciate
Thank you.
Okay.
Thank you.
Bye-bye.
A lot of value information. Thank you.
Awesome.
you.